It required a lot of patience and courage. That is the truth about it. For the job offer, I'm new in Ireland, so I don't really know much what is happening. But with the information, I discovered that it's because of the HSE issue. I think their demand or their requirements on the hand of the agents, I think they are finding it difficult to meet the demand of the agents, are finding it difficult to cope with the HSE demand. That's what I feel anyway, because many people have been applying for LWS without getting it because their agents refused to put in place the requirements of the HSE. So I myself started this journey in 2021, August. But I came this island this year, February. So that is to tell you how it is. It's not something that maybe because you were able to get your DL within 2 months, 3 months, you feel that it's always like that. Island journey requires a lot of patience and prayer. I got my DL exactly 1 year, August last year. August last year. That is exactly 1 year of my journey. I applied August 8th. I got my DL either August 12th, 2022. But to God may help it. Before then, I have gotten this offer. I got my offer May. After that offer, I had so many interviews with different agents, so many, without getting any offer because I was actually looking for maybe to work in a hospital. I just see it that with my knowledge and experience that I don't need to go to all this home or whatever, whatever. So that's offer I got that May. From that May till I got my deal, August, October, I didn't receive any offer. It's just unfortunately, one reason or the other. Before I have to go back to these people, I signed their offer, but I did not sign their contract. Even when they chat me or send me mail, I will just tell them that I have not gotten my deal. So when I discover at the end of it, oh, good, October, no offer yet, I now open up and tell them that I got my deal. So I now signed their contract. I had issue with AWS too. So people should not think that it started recently. They applied for my AWS. They denied me my AWS. So my agent did not let me know. I was worried because I was meant to leave November, according to them. I was so worried about it. After everything, they have to send me mail that owing to the fact that 6 people that brought to the island to write exam, out of 6 people, is only one person that passed. And the rest 5 was sent back to their country. So because of that, they don't want us to experience such thing. They have encountered loss too. That they want us to read more 3 months so that we will not be able, we will not go back to our country. I said, okay. By then, I have given out my retirement letter to my place of work. I don't know what to do again because I wanted to give them 1 month's notice. I have even bought a lot of things to travel with. I made arrangements of traveling. I started sending them mail, Some people were like, that should see if I can contact so many other agents and ask them. But at the end of it, they were not replying my mail. They they were not replying my mail. They keep as if we are not seeing my mail. So it's somebody, I think it's Notolu was on like that. I should just be calm with them. That these people are so that Ireland, these people are so mean that they might decide to even ban me from traveling to Ireland. I kept quiet. So God may help me. I rushed back to my place of work and I was able to retrieve my retirement letter back. So I continue with them. I was excited, still hoping that one day have effect. So towards November again, ending, I sent them mail because then my exam was shifted either August or June, either May. I sent them mail that my IELTS is expiring May. And also, all these things, if at the end of it, my police clearance, the new one that my police clearance, all these things are expiring. So if they cannot bring my exam date before May, that I will cancel the contract, because I can't write IELTS again, only for the fact that I have given out my job because of this journey, and you people still shifting my exam to May. She now replied me that I should not worry, that if that is the problem, they will try and bring it forward. Then bringing it forward without AWS, I wonder how it will look like, how possible it will be. The person there applied AWS, my own, before her own. Her own came out. They hold it. They did not send it to her. They told her that her AWS is with them, but they won't release it. I say, these people can be mean. Let me just tell you, Ireland is not they don't have conscience. They care for what they will get from you. So towards that early December again, I sent them mail. I prayed and prayed and prayed. Send them. Everything is prayer. I was online prayer. Only if you know your religion, you pray.
I pray too for
Send
it.
them that since they are saying that they will shift my exam forward, that Nigeria presidential election is coming up March, early first week, early 2023, and it takes about 8 to 10 weeks here to get visa. So they should try and apply for my LWS for me to beat, because if I will be in the country, this election starts, I don't know what will happen. That day, when I send the mail, I now call the man they always used to apply for the LWS. I called the man, explained to the man. The man's okay, that he has been waiting for her to send another contract so that he will apply for my LWS, but nothing, that he's going to reach out with her. The next day, I got another contract to sign, because them, why that one denying? There are a lot of amendments. Every day they will send me another one because of HSE, this amendment of issue. I keep signing contracts and printing and printing and printing. At a stage, I was on like, what is this? 10 pages every time I will sign, print and sign, scan, call Lord. Yeah. So the next day, after I have spoken with her and sent mail to the man, spoken with the man and sent mail to them, they now send me a new contract to sign. When I didn't waste time, I have to sign, do everything immediately. I sent to them back, called the man and told the man that I have given them, I have signed another contract, so that he should also at least talk to them. So after 2 days, I chatted the man up, say, how far now? Have you gotten my new contract? Have you applied? He said that is what he just finished. He just did it nice. Okay, thank you very much. Luckily to me, within 1 week, I got that LWS. I have to apply for the visa, and they begin to change my exam date. So I'm just saying these things. It's just to let you people know that Ireland journey is not easy. It took me almost all this process. I was still going on trying to cope, even though with the frustration, I got tired of the whole thing. But people will still tell you that it's doable. I was hoping. For those of you that have gotten offer, waiting for your AWS, the issue is that because of those changes in HSC plan, some of the agents don't want to do the right needful. That is it. And if your job offer is with HSE, you have to exercise patience, because is a government. There are many people that will sign and review it before you get your contract. Why sometimes it's easy for private people like OSP, all this private, is because they don't go through a lot of process. They own their, they can change whatever they want to change. But HSE, it will tarry, but it will come to pass. Because I have so many friends that was with HSE. It took them a lot of time for, even baby nurse, took her a lot of time for her to get her contract because it's HSE. That is the problem. For the job opportunity, I don't really know much about that, but I'll believe that the way we misused it is also affecting us. And during our own time, DL comes once in a blue moon. It can come 1 month, you never see DL drop. 2 months, DL. If it's DL drop like this, everybody go there happy. As if say nah, the visa ain't come out. As if you have gotten your visa already. So recently, DL, the way the rush, the way they release DL is, I would say, is more than the job opportunity. During our own time, DL will be seeing job opportunity because there is no DL. Who has DL then? Nobody has DL. So the little, if you have seen, that's why I was able to get a job without DL. If you have seen education assessment or towards that, you go there happy, you will be happy. At least you have hope. And they can easily apply for job and get because they believe you are coming up. But now they are releasing DL as if is because people are meeting the demand and how to apply to for registration. That's why you see that people with DL outweighs the job opportunity compared to our own time that job opportunity was much than people with DL. With they may be saying that we will sign offer here. These people have link, they know each other. Once they notice that you are doing something with this person and trying to do something with this person, you see, they will may even decide as if they that you are, they will just keep calm with you. They will keep quiet. They may not go further with you, but they will keep quiet. They have link. All these agents, they know each other. It's when you apply with this one, you know that these people they have. So the way we are signing offer here without excising patient, we want to leave the country immediately. I got my offer in May. From May to this time around, you know how long it is. But I was still getting advice from people, don't do that. Follow them this way, follow them this way. So that is another thing that is affecting us. And that is the problem that almost what happened to UK people. Because they will sign COS, these people will be applying, this agent will be applying. They will have to. So my sister, for the job and everything with prayer is possible. Just keep applying every opportunity you see. Review your CV. Check even with prayer and with time. If they review this thing, they're trying to this demand. I believe from, let's say, from April, May, because as it is everywhere, they have annual budget. The budget, my agent was telling us the other day, the budget is really affecting them. The annual budget for the health care is affecting them. They are not meeting up. They are trying to review so many things. So maybe before April, May, things will normalize. It's everywhere. First 3 months of the year is always things slows down. It's after that we see things will be moving because people are trying to make their own budget, try to put things in place. So I believe April, May, things will also be fast again. If you have applied for AWS, keep praying. And now they have come in a way that if somebody pay for you here in Ireland for AWS, they will deny you AWS. My agent paid for my AWS here in Ireland. They didn't deny me, but see the another tricks they come now. And so know so many people that have paid their own here. But now they have come that if you apply, if somebody pay for you from Ireland here, they will deny you your AWS. So these people keep coming with so many tactics that is only our prayer that can help. It's our prayer. If you have your deal, pray. Job will definitely come. If your own is close to expiring date, my dear, that is what it expires. So that one, I don't think there's nothing they do anything about it. They only consider that ayet of a time when they feel that they slow down in their process that make ayet expire. But for dear, if it expire, there's nothing you can do about it. To me, I think you still start afresh again. But let's just pray that it didn't expire in our hand.
Amen. Oh.
Any questions so far?
So, okay. Okay. I heard your this thing, your exam process and the all the experience. Any
Too much. It's just that so many things happen in the platform. The way we were taught sometimes is not the way it is now, because if I had I grounded myself with information in the class, training and everything, they really help. They are helpful. If you are the type that participates in the class, especially if they move you to a RCSI class, try to participate in presentation. It helps a lot. Correct people. Don't be shy. Don't be shy. I have never seen someone that is active in that platform that failed the exam. That is it. The RCSI is doable, although the fear will be there, because I personally, I was so afraid, because I know that my agents do send people back to their country. So many things was going to my mind. I have given out my job. I left my family, all these things. If I should fail this exam, I wonder what my fate will look like. So I thought of so many things. I was active in the class. If so, okay, none of you is in the RCSI class. If you are there, you see sometimes it will be as if I'm doing arguments or whatever. I have worked in acute setting. I'm a trained nurse, so I have worked in acute setting for 10 years. So sometimes my argument based on using our common knowledge to do the right thing. These people are professors. They are not there to fail you, my dear. RCSI, these examiners are not there to fail you. Before you see an examiner, maybe see that you are sitting at a particular station, it must have compromised safety of patients. These people are helpful. They prompt you. I keep telling people, if I'm assessing people, I keep telling them, make sure you knows it. He knows it, so that when you are prompt, you'll be able to answer it. Then they will prompt you, don't know it. Read and learn anything you know about this exam. Be active. If you can beat 10 people in the platform like this, you'll be able to present there. Is it before one person that you will not be able to talk? So there's nothing changed, nothing really changed anyway, just that it's not really the way we think. Hand hygiene, sync check safe, listen. During our MCQ, Maria said, if you have this Q, check, identity, permission, listing, you will pass RCSI. So she now gave an example of her mother, said that her mother said, when she was admitted in the hospital, her mother was on like asking her, these Filipino people, don't they have common sense? Why is it that they easily forgot? They will come back in 1 minute, ask you, please tell me your name and this and that. They will come back in next minute again. That she was laughing, telling her that is the routine, that they are doing their job. That is identity and permission. So for all my stations, they all went well. But within me, I was afraid of mine. admission station and ISBA, because ISBA happened to be my first station. And almighty ISBA, many people see ISBA as something that is really taxing ISBA. In as much as I know ISBA, but I hate it. So when I noticed that ISBA was my first station, I was like, God, where will I start? What will I do? I went in ISBA station. My hand was shaking. Even when I wanted to put hand sanitizer, I didn't know when I flew my hand. I was like, in fact, I cleaned it in my clothes because it was much. My hand was shaking. My
Oh my
hand was
God,
shaking.
not small.
I was calling. If you know your God, serve it very well. I was calling, Our Lady of Good Success, help me. Our Lady of Good Success, help me. The woman gave me her instruction and went. I said, God. I tried as much as I can. When she came to me and asked me that she should start communicating, then I was still looking for doctor's name. I can't find doctor's name. I saw that early, but I was thinking it's early in the morning because the time it can't. I didn't read my scenario. I didn't read it complete because of I'm trying to see if I can beat the time. So when she now appears, say I should talk to her that she's the doctor. I said, please, ma, excuse me, ma, please, ma. She said, what is it? I said, please, ma, I can't find the doctor's name. Please help me. She now showed me the doctor's name, which happened to be that early that I did. Anxiety and everything did not allow me to notice it. Even though when I wanted to write it down, I wrote it in the wrong place. So we started the conversation. After much and much, she dragged me. After much, she said that she's coming in 1 hour time. I documented, asked her, what should I do? She said, college Sputum for MCS. I said, okay, fine. Documented, Ben Rag. I went out. I'll start thinking about it. My mind, I now remember those advice. Don't think of the past. I move ahead. Even when she asked me, is the patient on an antibiotics? I didn't even notice that the patient was on antibiotic. That was when I look at my scenario. I say, yes, she was placed on antibiotic on admission. It's okay. So then I should just say, I'm coming back for ISBA. I went, chest infection remained the same. The only thing I noticed in chest infection is that when you want to confirm prescription, you confirm it with your the patient wristband. If you are reading prescription, you are going to read it together with, because I just start. The woman say, what am I confirming with? I said wristband. She said, perfect. I picked the wristband and it's okay. Everything went well, that one. Then for infection prevention, that one too, it was okay. The only thing I know that she told me that the tap, the water is as the water is coming with pressure. She advised me, take enough liquid soap, take enough. I did. She said she demonstrate without talking. I demonstrated. When I on the tap to wet my hand, she off it back. So after doing the demonstration, trying to regulate the tap, it was not easy. If I do like this, the water will pour on my cloth. Say Jesus. I tried to control it so at least in a way it will run without splashing. The thing wasn't really happening. I wasn't like, I'm sorry, ma. I have not used this type of tap before. See me. I turned myself to Jew girl. I have not used this type of tap before. This is not the one. She was like looking at me. After everything, I tried to regulate. She said, yo, wash. When I was picking towelette, she said, pick enough. Use your two hands. Drag it. That is to tell you that these people are there to help. Drag it. Use your two hands. With fear, I just tried to clean as much as I can. I went back to her. She said, there's water still dripping out. I should go and clean. I should go and dry it. I went back and dry my hand and come back to her. Then the next thing was hand rub. The next thing, 5 moments of hand hygiene. The next question was when hand rub is not effective. That was something that I used to sing like national anthem every day. I couldn't remember it anymore. I was on like Clostridium difficile and norovirus. She said his remaining one that I've just said one. So I can't remember anything again. She was prompting me by raising her hands up, doing her hands to show me. That was when I remember when the hand is visibly soiled. She said, perfect. Every other thing went well, donning and doffing. So next station, wound dressing went well. She picked me very late. In fact, she picked everybody very late because the 10 minutes starts when they ring the bell. So even if your assessor come late to pick you, your 10 minutes have started. You are still outside. It's not when you enter inside. So she was on like, when I win my trolley, everything is on the tray. She said everything has been set. Just carry your trolley to your patient. I move. So when I wanted to clean, she said, just clean once, clean once. Time is going. Clean once, clean once. I clean one, dry once. She said, put your adhesive. Let me see how you do it. I did everything. Clean the trolley up shelf. She just showed me how you clean one of the pool. I clean. So for my dressing, I did something that I felt. That's why I say you need to pray. In as much as you're waiting for your LWS or DL or whatever job, be prepared and pray. So when I opened my dressing pack, I used the yellow nylon, I arranged everything. I did not remember to open my surgical glove inside the paper. So it was folded into two. They folded the first one and folded it into two. So I didn't remember to open it. So now I'm ready to wear my glove. I don't know what to do. I was like, God, what is this? God, what is this? What will I do? What will I do? I don't even to talk to my sister. I don't even know. I was just saying, this one is a great mess. So she noticed it. She said, what is it? I said, my sister, sorry, I supposed to open my glove with the yellow nylon. She now went and picked latex glove, fold it and drop it for me. Say, assuming this is a sterile glove, show me how you wear it. I wear it. So these people are there to assist if you have prayed. Although some people had such mistake, they did not assist them. Some persons, even just maybe because of one thing or the other, then it's grace. So I finished the dressing. So, and another thing is that when they notice the way you started, if they see the speed and I started very well, any mistake, sometimes mistake, they just see it is maybe we are under pressure. So went for eye news. I did my eye news, escalated. So when I wanted to clean, my pulse oximeter now fell on the floor. Say, oh, another station to receipt. Because I heard of somebody, they said the thermometer fell on the floor. She went back because of that. My pulse oximeter fell down. In fact, I made a mistake for my escalation. I have a total eye news score of 4. My assessor was on like, what is your blood pressure? That was when I know that my blood pressure is supposed to be a score of 0, and I put a score of 2. So I said, my assessor, sorry, it's a score of 0. So you see how they are there to help. That was when I canceled it using an NBI canceling type. So when she got up, she said, I picked the pulse oximeter too. I said, my assessor, so sorry, it fell down when I wanted to clean it. She didn't talk. She just keep quiet. She just pressed the button to see if it's working. Because the woman is an Indian woman. Throughout the station, she did not talk. She don't even look at me. I was like, this one, I'm doing this to somebody. Nobody is talking. Nobody is looking at me. I hope I'm doing the right thing. The only time she talked was when she asked me that question for escalation. I went for urinalysis. That one helped. It went well. It just bundle, teach a man how to clean. What is oligouria? What is anuria? Her weight is 60 kg. How many mils of urine I calculate because there is calculator there, paper. She now took me. In fact, the cattle bond immediately I mentioned 3. She says, it's okay, let's go. Go and do your urinalysis. I went. So we do the urinalysis. It was cloudy. There was presence of blood. In fact, she was, when I was mismatching the dipstick and the strip, she was helping me to tell me this is where it is. This is this one. So she helped me. She assisted me. So we finished that urinalysis, and the patient's teaching her diabetes. The woman just asked me that she's diabetic. The doctor told her, and she's going home. What will I advise her? That I should tell her how the thing happened. I give her small pathophysiology of diabetes. When I mentioned insulin, she now asked me where is it produced. I now told her the organ that produces the insulin, the hormone. She said okay. She now asked me the causes, that she's a driver. What will I this which kind of food will I ask her? How will I advise her to go with before she leave uh, go with? So I now say okay, that's fine. You eat all diet but in a little portion. Since you want to be going out with food, you can go out to avoid going eating junk food. You can go out with rice with vegetable or potato with chicken sauce. I didn't know. So she now talk about her HbA1c that is high. What does it mean? And I told her that it means that you are not controlling your sugar level. It's poorly controlled. It's okay. She talk about metformin. I should tell her about metformin. I just educated her about metformin and the side effects. She said metformin is any other drug doctor will prescribe for her. So I was saying all this sulfonylurea and glyperimide or whatever. She was giving her, doing as if injection for her body, doing pointing to show me that is an injection that she want to hear. I said insulin. She said, okay, that's fine. Is there any other? She didn't ask me. She just asked me exercise that she will be doing. I told her, okay, I understand you are quite busy, but you have to make out time, even if it's 30 minutes walk 5 times in a week. She's okay, fine. She talk about foot care. That's how she feel that the doctor said he will refer her to podiatrist. What does that mean? I now explain the importance of that and educated her on how to care for her foot and the type of shoe she will. So okay, fine. This is the end of your station. And now that was when I said, okay, I'm going to be leaving leaflet for you so that you go more and join the association of diabetes. We went out. I think that was all in the first 7 station. I finished and waited. So after the time, we now went downstairs for the remaining 7 station. So the first one was calculation, medication. It went well. It's just that weight-based calculation. You just simple that one. They convert 1 hour that you need to convert, and you need to times with 60 minutes. Was the first one. The other one, you don't need much conversion, just simple. She took it from me when the time which she collected it. She didn't say anything because people that have written said that if you make mistake, she will ask you, are you sure this is your answer? So when she collected from me, without saying anything, I said, okay, maybe I got it right. We went inside, talk about Superball, when medication is good, 10 rights of medication. I just mentioned to, she says, it's okay. That she teach her about inhaler and how to use it, how superbug is prevented. Then she now said I should serve my medication, which is natural ferritin. After her education, when I want to give her, she said, don't worry, it's okay, let's go. And this is the end of your station. We went out. I went for angina. Angina went well. The drama was fine, the way we used to do it. But the truth is that sometimes all those hand hygiene check, because they will just take you, follow me for a station. If you enter, they ask you to sit down, or if there is a seat for you, if it's the one that you sit down. The next thing they will say, okay, patient, you met patient slumped, okay, that she's the patient sitting on the chair and she rang bell that she start. But when they say that start again, you not even remember all this hand hygiene since they said, oh, I seated her back to bed. She was on like the bed. She relaxed on that bed. She didn't stand up till I finished the whole station. I documented, because that one you document, chest infection you document. They give you paper to document. So that one went well. Finished the station early because I understand that if you are missing something, they will drag you to give even the third dose of the and the medication. But if you have said everything early, once she said, the next thing she will tell you that she feels she's okay. So that one went well because I give my education immediately. Like after I gave her the first, so I started giving her the education. So the IV priming went well. Just normal thing we used to do. Talk about fluid spillage, then we give the infusion. That one, nothing changed there. Then student teaching was stroke and the MRI just prompt. So this education now is mostly prompt. He told me that I should define stroke, types of stroke, the causes. So he said I should use the acronym of FAST to describe the signs and symptoms of stroke. It's okay that he will be going for MRI and he needs conscious sedation. What I should talk about conscious sedation. I said everything I know about conscious sedation. Said okay, that how will he go home after the thing? I say you go with a reasonable adult, don't sign legal, those things that we used to say. He said, okay, this is the end of your station. That I should write 2 things I did well and 2 things I did not do well. Ha! I said, for this station again. Okay, wait till I do well. I talk everything. I will ask me. I said, okay, things I did well. I carried you along. I answered all the questions that I was asked. Things I did not do well. I don't know what to write. I was coherent. I was, I was, he said I should read it. I read it. He says, and another thing, that I did not maintain eye contact. I said, should I write it? He said, don't worry, let's go. We went out. Another station that I had issue was admission station. The woman, the woman is not smiling. In fact, everybody that day had problem with her. So the way we used to say it in the platform is not what she wants. It's Waterloo. So when I tried to, she said I should start this and that. In fact, before we even start to say, she said, your time is going, 5 minutes, 3. Say, sure. So when I asked her question, though, whether she's having this edema and swelling, she said she don't understand what I mean by that. I don't know how, because we are told that we should use the language the patient will understand. I said, I mean swell, and I was trying to describe edema. She said she don't know what I mean by that. My time was going. I said, God, Jesus, what is this? So later, when she know that I don't even know what I ask again, she said, read it. I say edema. She said, okay, no, she's not, no edema. I said, okay, oh. So we reach for each other thing, anemia. I said, has your doctor told you that you have reduced blood volume or you have shortage of blood? She said she don't know what I mean by that. Yeah. Jesus. I tried to describe the anemia. I was even using the symptoms of anemia. When she said she don't understand. So another thing, after a while again, she said I should read it. I said anemia. She said no, she don't have anemia. So for the which mobility, she says she's used walking stick. I was looking at the whole thing. There's no place they put walking stick. I was on like, wait, walking stick, walking stick. I said, this woman, God go punish me and you today. Walking stick. I can't find walking stick. I said, should I put the walking stick for fidgeting or should I put it where? In fact, I don't know what came to my mind. It's just to put restricted. I said, that means you are restricted. I'm going to give you a score of 3. She no talk. It's okay. For food, she said she don't finish the meal. I put poor appetite. So for all this paraplegia, I describe paraplegia tire, become a stammerer. Say paraplegia, lower limbs. Do you freely move your lower limbs? She said she don't understand. I was using hand to demonstrate. She said she don't understand. So later again, she said she will read it. I said, paraplegia. She said, no. My dear, time don't already go. I don't lose hope for that one. Medical preparation. I talk any drug that reduce swelling, any pain medication, drugs for cancer. She says she don't understand. I still they repeat the same way we are taught not to use the language the patient will understand. Say drug that reduce swelling, swelling, swelling. They describe swelling as if say she said she don't understand. Later she said she give example of the medication. I said something like prednisolone. She said yes, she's on prednisolone. I said what of ibuprofen? She said she is on medication for cancer, treatment of cancer. She said she's not on. So medical preparation, my dear. I give my calculation and tell her the total score I have. She did not talk. I begin my management. Now just surface of the skin. I was able to talk. I'll be using cushion free from crumbs and friction. Make sure that the surface is this. That was where I tried to talk about inspecting your skin regularly, turn the rank bell. So I didn't finish the Waterloo. I went out. So yes, this is another station I'm coming back to receipt. So every other station went well. But when we tried to review further after the exam, they said they really want us to, for that Waterloo, when you say, do you think you have edema? That is swelling. Or if you use swelling, say that is edema. If you use it in a medical term, we also use it in a layman because the assessor is also a professor. So you don't just come and use that only language the patient will understand. So when you think of it, may be anemia, that is shortage of blood. That is what she was expecting. So the person that said that, which I think is real, because for her to be asking me, I should read it, but just that the prompt, I didn't understand what she wanted me to be doing. So that is how they want the Waterloo for now, which we don't know if they will actually change it, because the people that practice it that way after us, they really went through it without stress. So when you use the language patients will understand, you still use that what is written in the Waterloo form. I think every other thing went well. So I prayed. Luckily, I noticed that I passed. It's not by my own grace, because I really prayed, and each station I was entering, I keep praying before, while I'll be standing aside to read. I also be telling God, Holy Spirit of God, possess me. I'm a Catholic, so I was just using Holy Mary, Our Lady of Good Success, Our Lady of Good Success. Take care, Our Lady of Good Success. So if you know your God, even if you are a Muslim or whichever you know you serve, that be prayerful. With prayer and this exercise is doable. The assessors are not there to fail you. And they are nice. In fact, they are just seeing you as a first year student. They are nice to help. It's only become worse when they prompt you. You don't know, you don't understand what they're saying, or you don't know how to go about it. That is it. The prompt was there, sepsis station was there. It just went well. She was asking questions intermittently. Just listen. Don't do what you are not asked to do. You just enter the station, begin to lakram and pour. That is what they are trying to avoid this time around. If they give instruction, define. That is what they want. It's more of now prompt and interaction. They will come. If it's sepsis, they will say define sepsis. After that, keep quiet. Tell me signs and symptoms. After that, keep quiet and listen. So listen, focus, permission, identity, all those things is very, very important for this exam, because what they are interested of is patient safety. They don't want anything that will compromise safety of the patients by you making mistake of not finding your patient identity, not confirming it. That is what is really needed for this exam.
Wow. Congratulations. So I'm very happy, oh, really, really happy. Um, we are we are going to congratulate her so much on top of the one that we have said earlier. Congratulations,
Congratulations,
congratulations.
Mama. Congratulations.
Thank you very
Congratulations.
much.
You
My
really
sister,
tried.
congratulations. Thank you.
Thank
Congrats,
you very
man.
much. Any question? We are really sorry for what is happening in the platform. I know that most of you are stranded because of the Telegram class. But
Congratulations.
thank you very much. So, if you have any concern, ask your questions, private chat, but just know that sometimes we might be busy not to reply your message because that is what most of us are doing. When they chat you up, I know so many people that chatted me up. Maybe if you don't get their question, ask them what they mean by that. They will say, don't worry, don't worry, don't worry. It's not like that. It's the verse for who you want, who is the verse for? Who are you angry with? So in this journey, you have to be patient and polite enough to ask. That is how it goes. Nobody, I passed the exam, it does not mean that I'm perfect or I'm too intelligent. But grace and prayer, and also with your effort, because I was on like effort. When you have done your own part, you will hold God like this. God, I have done my part. It's now your own. Because even the Bible said, heaven help them that help themselves. So that is my advice. So whenever, do your own best, so that as you are facing the station exam, you have so many reasons to hold God like this. When you have grabbed God like this, He will not escape. When you have grabbed God like this, He will not escape. He will not run away. He has nothing, in fact, he has no reason to leave you because you are now holding him. So do your own best and pray. Don't be shy to ask your question. Don't be shy to seek for advice. Don't be shy to chat anybody that you feel that it will be of help for you. When I was in RCSI class, I was on like, how will I start this presentation? I will see people, pim, 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 I was God. For Telegram class, I never want to presented. I said, God, what is happening? I have to start with somebody I feel that she can help me. I called her, chatted her up, say, please, I'm finding it difficult with this class. I'm not getting what people are saying. So both of us started, she made time for me. We started having reading together. We become reading partner. Before you know it, I now picked. Even she herself, even while we studied, she now started calling me assessor already because I I was so fast to pick, learn from her. I started adding
My
also
ancestor.
my knowledge. So in the class too, I will look for people I feel that these people has something. I will chat. If I notice that you have something to offer to me, I will chat you up. I beg, let's do this, let's do this. Even with my work, I'll come back from work. Yeah, he's tired, but I have to still make time for that. Sometimes my children, I will ask them, I beg, go, 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 go. Tomorrow now you would say that your mom is in fact, your mom is a failure. Go, go, go. They will just, so tomorrow now, it's you people that will start blaming me. Mommy, you are a fellow. Your mates are in abroad. Go, go, go. I don't want. Go and meet your auntie. I will chase them away. Even the small one will be crying. But I know I need it because tomorrow it's them that will blame me. So even at a stage, they themselves can't understand. Before you know it, they will say hand hygiene, sin check self. They follow on, they do RCSI. So as you're in the class, look for reading partner. And to the glory of God, all my reading partner, at least I know how many of them have written past. So don't be shy to chat anybody if you feel that this person will help your wisdom, will help you. Go for that person. If you chat, keep chatting that person. There are some people that I will chat, I will keep disturbing. Sometimes I will say, abeg, I will not call this girl again. Her guy is too much. But when I look around that maybe this station I will still need it. I need her to put me through. I will still chat her up again. So don't just feel that you can do it alone. Except you are the type that read alone. But you need to share knowledge. You need to learn from people. You need